the Pathway Studios in Johnston proper. You are live from the path.
And you're listening to Live from the Path. We're coming to you from the Pathway Studios here in Johnston proper. It's very good to be with you this evening, and I'm pretty excited because we got legit folk on the interview chain, Mike.
I've met legit folk in my day, and this certainly qualifies.
I know, that's what I'm saying. That's what I was pretty excited about. So let me tell you what's going to go on the show this evening. So we're going to talk to Matthew Loftus, and if you guys remember from I don't know, it's got to be 3 months back. We've been trying to go through how does good news change the world, and so we had talked to Robbie and Aaron from why do I always forget the name of the ministry, Mike?
It's Discover Hope.
Yeah, Discover Hope, right? So like they were working on talking about drug addiction and stuff in Newton, and just talking through like what does it look like? How does the good news actually tangibly change the world? Because I believe it does, both in a very broad and awesome spiritual sense, but then in a hands and feet tangible sense in our current world. We think that's true. So we had talked to kind of Robbie and Aaron, and we've had a number of different conversations around how good news changes the world. And one of the things we wanted to explore was the notion of healthcare. And when we were talking about it at the time, it kind of ebbs and flows on how people talk about it or how it's in the news. But it was a big deal, and I think it will remain a big deal in our political landscape. And so we wanted to try to get an angle on how does good news change the world when it comes to healthcare. And I came across an article on Mere Orthodoxy written by Matthew, and I felt like it was a very important perspective or piece of a conversation, and a discussion that I feel like we can have that's got some inertia to it, that it doesn't feel like we're just kind of calling out into left field, complaining about costs of things or impacts of things or the lack of justice in things, and it felt very, very tangible to me. And frankly, I read it and it felt like good news. It felt like there was something happening, or there was opportunity out there for people who wanted to express the love they have for the world and the love Christ has for the world. And so that's why we wanted to hook up with Matthew. So we're going to talk to him. We're going to get to know him a little bit, and have him kind of walk through some of the thoughts that were in that article, and then other things that are kind of peripheral to that. And then Mike, we got some advice on Dear Life from the Path.
Yeah, I'm sure we do, Ben.
Okay, very good. And if we get to it, if we have time. We skipped an article when we were talking with Crystal Joy last week that was around ladies and cheating.
Yeah.
And it was and like the differing reasons for ladies that women are giving for stepping outside of their marriage, and the nuances that were crafted with some of these reasoning. I just thought were extremely interesting. It's worth trying to understand, like, where does that stuff come from, and how does that change how we understand those types of relationships and how people are reacting to marriage in general. So. If we get to that, we'll do it. If not, it'll push another week.
Yeah,
it remains. I feel like it remains a problem.
It will abide.
Okay, so let's touch base with Matthew. So on the line we've got Matthew Loftus, and Matthew, I will just I'll give you the chance to introduce yourself because I think you'll do it better than I would. But you find yourself as you're a doctor and you are currently in East Africa. What does a road to Africa look like for a Matthew Loftus?
Yeah, well, thanks guys for having me on.
Sure.
It's an honor. My road, I guess, looks like a lot of doctors who end up in Africa. I grew up outside of Baltimore, and I was homeschooled. I went to college, and I started going on some short-term summer trips with my church when I was a teenager, and while I was in Kenya when I was 17, I felt called to long-term cross-cultural missions, and so since then that call has just kind of been refined, and as I've gone along in the steps. So I went to college and felt like medicine would be the best way to sort of use the talents I had to serve God, and then the next step after that was realizing that there was a huge need for medical education in missions, not just going and doing, but teaching others how to do it. And then the next step was, 4 years of medical school, 3 years of family medicine residency, and the whole time starting to look at different organizations and eventually start visiting places to work and raise support. Got over there. We went to South Sudan for about a year, and we were planning to stay much longer, but unfortunately the security situation there deteriorated. So we came back home for a little bit, had a baby, and then went back, and now I'm getting prepared to join the faculty of a university here to help be a part of their family medicine residency program here in Kenya. So I'm very excited about that.
Yeah, congratulations. That's a cool opportunity.
Yeah, I'm excited.
So you talked about having a baby. So what's the that winding road led to marriages and children along the way? How has that been, kind of doing what you've been doing, and having your family be part of that?
It's been great. I mean, obviously my kids are great. They're loud and wild, but they're great. So was I when I was their age. And yeah, I mean, obviously, there have been challenges with it along the way. Like when things started falling apart in South Sudan, they had to leave the country. I had to send them out of the country, and I had to stay back to keep the hospital running. But I think in some ways it makes it, having kids around has always made it easier for me to have conversations with people, just because kids are generally a bit more gregarious.
Right.
And people are more gregarious towards children. So, for me, naturally shy, especially with, people from other cultures. And so having the kids around is a great way to just start conversations with people and connect with people. And it certainly has made me a more humble doctor, to have children to deal with and
right.
understand why people, bring their kids in for things that I didn't understand back when I didn't have kids. So
right.
So Matthew, I have a question for you. Do they look at doctors the same in that culture as we would?
I mean, it's there are some similarities. So, certainly doctors are tend to be well paid and high status in society. But generally throughout East Africa, as far as in all the places I've seen, there's a certain degree of trust in biomedical Western medicine. But especially the more rural you get and the more traditional people are, they're more likely to try traditional methods of healing or kind of local lore before they'll come to a biomedical provider.
Have you ever been surprised by local lore as being actually a pretty good deal?
I mean, a lot of times people are afraid to share
sure.
what they've done already, what they've tried already, because they think you will write them off if they do. So unfortunately, I haven't gotten really an opportunity to hear the details of what people
like a dragon's tooth and whatnot. Bummer.
Yeah. But I suspect that there's probably some things that work very, very well, and others that don't.
Right. What would you say, or in what way, if any, would you say doing medicine in Sudan and kind of in the African context do you feel like that's changed how you look at medicine at all? Do you think that's influenced how you how you think about healthcare in general?
Yeah. I mean, it's interesting because I obviously trained in the West in a very rigorous scientific milieu where it's where spiritual causes of things and are assumed to just simply not exist. And
right.
Spirituality is generally thought of as kind of this nice add-on. If that's something you have the time to do and address with your patients, that's nice. If they want it, if you're open to it, but it's not really relevant to why people are sick.
Right.
But here in Africa, that's not the case at all. Most people, even if they are, basically, you'd have to be an out-and-out atheist here, which there aren't very many,
right,
to assume that spiritual forces have nothing to do with why people get sick or get better. And on top of that, like the way that your spirituality affects your life and the life of people in your family and your body, it's just very different. And so even though some of that, I think, I still don't think is very appropriate. Like, oftentimes, if a mom here is having a difficult labor, having her baby, they assume that, she must have done something wrong or she's holding a grudge against somebody. And
like Job style.
Sometimes, yeah, like that can definitely be part of it. But I think in general, it's probably better to work from the understanding that there are spiritual forces out there, that they can affect us and they can affect our bodies. And I think we all, even though those of us who believe in germ theory and, can try to find a scientific basis for everything, recognize that health is, that members of the community, by their decisions can affect the health of other people in the community, like secondhand smoke,
right,
or pollution, or, stress.
Right.
All of those things are, those are words that we use to try to get a handle on the really big ways in which people can affect each other's health in relationships with one another.
So that brings up what I thought was an interesting premise when I was reading your article. One of the things that you said, that there are deeper philosophical issues when we talked about health, and you had said we can't agree what healthcare is for, what its goals are, because we don't think about what health is or what it means. And you kind of further in that paragraph said we take a very scientifically reductionist approach to what health is, which means we reduce indicators of health to things we can measure and sell a pill for. And so can you expand on that a little bit? Because I think you touched on kind of how that we may be limiting our understanding of health either communally, or it's only a specific thing about our bodies, but it's a much broader concept than that.
Yeah. I think health is stewardship of our bodies, and making the most of what we have, what we have been given. We have to start with, I think, what we have been given. Our bodies are a gift from God. And sometimes the gift looks different. In many cases, especially the older you get, the more pieces and parts of the gift are not working the way that they should. And, but even there are people who are born, with, different disabilities or diseases. And, so health is stewarding what you have, so that way you can glorify and worship God in the body that you have. And then, from there, I think we think about not just our bodies, but the world around us and our time, and thinking about, okay, how do we use what we have to make the most of what we've been given, which involves eating good food that's good for our bodies, and exercise, and spending time outside, and being with other people. There's very clear evidence that all of these things that are incredibly difficult to measure, like one's degree of social support and participation in communal activities and dancing and exercising and all that good stuff, like all of that affects our health in our bodies and lowers our blood pressure and that kind of stuff. So
one of the risks. Go ahead.
Good.
So I was going to. So is one of the risks that we run especially from a Western cultural perspective, where we seem to have. Well, let me ask this a different way. Is one of the risks that we run is that because we've so narrowly defined what healthcare is, and we've ignored, and actually I think your article gets to this, is because we've so narrowly defined what healthcare is, we've put our concept of health into the hands, or largely abdicated responsibility, both kind of often personally, but certainly communally, over to that niche understanding of healthcare of which only professionals play. And so it kind of takes away any of our agency, or I don't want to oversay on responsibility, but like it just seems like, we don't have as much control over some of those things as maybe we possibly do if we were to think about healthcare differently. Would that be correct?
Oh yeah. Yes. No, that's absolutely true. I think that, we think of healthcare in terms of what we can measure. So blood pressure, blood sugar, weight, all of these things. And even if we try to get into things like mental health, we still focus on, okay, so what are the symptoms that I can like measure and follow? What are the things for which we have a pill?
Right.
And if the pill doesn't work, well, what else is going on? And that sense of abdicating responsibility, I think, part of it was allopathic medicine, earlier on in the 20th century, gaining a lot of power over things that humans didn't have power for.
Right.
So it's really great that we have penicillin and chemotherapy and all those things, but the things that can get better with penicillin and chemotherapy and antidepressants, like that's still just a much smaller sliver than of life than what we can do for ourselves. And so I think we do have to kind of push back against that and say, what can I do for my health? What can I do for the health of the people in my community around me? And, sort of let doctors and nurses do what they're good at doing, which is dealing with, the things that we do have pills for. But just remembering that there's a much larger piece of the pie, that doctors and nurses are not very good at.
That's interesting. Do you think we gravitate towards that because there seems like a tangible answer there? So like if I have let's be real basic. Let's say I have a headache. Yeah. I know that Tylenol or something will otherwise help with my headache. The core issue may be because I've been sleeping poorly and eating poorly. That's why I'm sleeping poorly. But like that's harder to grasp, and it's longer to take care of. But like I gravitate towards a definitive answer. And so is some of that, I'm trying to think of the right way to word this. Is some of that a cultural desire, like something that undergirds all that says we like the fact that it's an answer. The unknown scares us, and so because medicine has answers, even if they're not always the right answers, and even if we kind of bundle a bunch of stuff into the bucket that isn't actually the right solution, because it is an answer, we like it.
Yeah, I think that's a huge part of it. Not just an answer, but also control. That we obsess over the things that we can control, even though in the end they may or may not actually affect it. So diabetes is a really great example because we can, we can to some degree control blood sugar, and we obsess about that number because it's a number that we can measure. Within sort of the more evidence that we accumulate about diabetes, the more that we find that sort of once you're in a fairly broad window of blood sugar control, it really doesn't matter how much more you control it to a certain degree.
Okay.
And it's, there are other numbers that we control a little more easily that seem to affect things more, like blood pressure. But having diabetes is a pretty life-altering event.
Right.
And maintaining your body in a healthy way is about way more than just controlling your blood sugar or even controlling your weight and your blood pressure. Like, because if you have great blood sugar, but you're miserable all the time, because you can't eat anything that you like,
right?
And and you don't even know what to eat. That's not, I think, stewarding health. That's it's just kind of juking the numbers.
Right.
So, so it's, and people get very, very afraid and really despondent sometimes, I think, when they have things that they can't control, or things that they can't cure. And certainly a lot of our toughest cases are, in medicine, is when we feel like there's something, there's some illness, even, maybe like diabetes, that could be controlled a little bit better with medicines, but, a person's family or job or just other life circumstances, their mental illness, what's going on in their neighborhood, those all prevent a person from exercising control over their health. And doctors feel really powerless and they get frustrated and grumpy.
Right. No, I think that's understandable. So it sounds like then that there's a couple of things kind of at play. Well, I mean, there's a million things at play here, but I'm going to overly refine the problem. We need a broader perspective on how we understand health in general. But then, and your article gets to this a bit, I think, is a broader sense of responsibility for our health as a nation. And I think this is something that is put in starker relief simply because of once you have the freedom to make choices, and we have such a strong growth of an individual thing that undergirds the story of America as a nation. But I suppose the risk we run is that the harder we fight for the right or the freedom to kind of make our own choices in spite of the impact or maybe in neglect of the impact of our broad community, over actually using that freedom per se to influence the broad community. Like, what does that say about our notion of the freedom that we have, right? That doesn't really say something positive about us. And so it's the same basic premise, though. I suppose it's saying that there's a broader outlook on our individual health to understanding the various things that make up personal health, and then you have a broader outlook of what do we value as a society. And you called it is looking at not health as a right, but as a social good. And so what does that mean, I guess, communally, if we reorient the thinking of health care as a social good versus the argument as to whether it's an actual right or not?
Yeah, I think when you think about healthcare as a social good, then that really opens the conversation for thinking about, number one, how do all the ways that we relate to one another, help each other to be healthy or not. You just think about sort of our built environment. So our neighborhoods and streets, are we designing the places in which we live so that way we can get as quickly between them as possible in cars? Or are we building them so that way we can, walk from one place to another, and interact with each other as we do? As well as, not having these risky streets where people who do walk or ride their bikes are more likely to get hit by cars. And then I think it also, beyond that, how do we orient our lives? Do we have neighborhoods with porches? where we can sit out and talk to one another? Do we are we creating a world in which we interact with each other and look out for our neighbors? Do we assume that if somebody is, someone, in physical proximity to us, one of our neighbors, is in trouble with health, that someone else will deal with that, like the government? Or are there, things that even the best government with a single payer healthcare system can't necessarily do, and, we as neighbors need to be looking after that person or someone in our family? And then that kind of gets to how we pay for it all, which is obviously a very contentious topic.
Sure.
I would argue, first of all, that if we take care, that if we actually met our basic neighborly responsibilities to each other and changed the way that we built, our cities and neighborhoods and things like that, and we're caring for each other in these very intangible ways, in the way that we ought, and that would probably make the whole enterprise a bit cheaper, because right now we spend so much money sort of chasing after things that aren't that could have been prevented through better preventive care, and are the results of people who have all this individual freedom and use it to put garbage in their bodies, or they just feel lonely, and loneliness is deadly. We're finding out more and more. So that's the first element. But then also, we would feel a certain degree of desire to see, to have things paid for in a way that kind of irons out some of the wrinkles and inequalities that we have right now. Right now our current system of healthcare payment is just so Byzantine. We spend 4 times as much on paperwork in the U.S. As they do in Canada. It's because we have so many different players and a completely opaque system for how the prices of things get decided. And so if we work on those things, I think we'd be better suited to to all be paying in as much as we can, and everybody getting more value for what they do pay in, and sharing the responsibility of the costs, so that people who are genuinely in need don't fall by the wayside for lack of payment, and those who have been blessed with extra are able to contribute for those people.
So okay, you're right. There's a lot of things in there. So let's start with so I think the traditional rejoinder to the thought of people falling through the cracks, right? Mm-hmm. Do you feel like is that happening more on the preventative care side? Because generally folks would say it's like people aren't being denied care at the emergency room.
Right.
So you can walk into an emergency room, but I'm guessing there's a bigger nuance to people falling through the cracks, either preventative care or major care that is long term and sustaining. Are those the two gap points?
Mm-hmm. Yeah, those are I would say, those are the two big gap points. I mean, I would say that preventive, at some point, there's not a clear distinction between preventive care and long-term care for chronic problems.
Right.
There's the simple, straightforward, and really tragic cases, like, someone doesn't get a mammogram, and, once they turn 50, and then 5 years later, they get a breast cancer that could have been detected. And, that does happen all the time. And that seems particularly cruel and unjust. But then on the chronic care side, it's, someone doesn't have insurance, so they don't see a doctor. They have this, this thing that's bothering them, and it kind of goes on and on and on, and then it gets really bad. They decide to go to the emergency room. They find out that it's, if they'd actually gone to a doctor 5 years ago, they could have gotten it treated and managed and dealt with, and it wouldn't have caused the problems that they're in now. But now they're at a point where, maybe their blood pressure's been so high that their kidneys are having problems. And because their kidneys are having problems, they, start having heart issues, and then they can't work as well, and, so on and so forth. And so, that's a very, messy and difficult place, to work, because, oftentimes people do sort of, depending on their life circumstances or how much money they have or whether or not they have a job, they kind of dip in and out of care, which sort of allows them to sort of know that there might be a problem, but not have a relationship with a healthcare provider that allows them to manage it appropriately. And my experience in the healthcare system is that that's where people are falling through the cracks the most, is in the management of long-term chronic health issues that need a certain amount of care and attention and medication.
Okay. So let's look at the other thing that you talked about. Then is when we look at communities and kind of the long-term. It's broader health perspective, but it's also kind of lowering the distance between a person who needs help and then being able to see a doctor. One of the things you kind of touched on was, can we widen the scope of who people seek care from and the types of care that they're getting, so doctors can focus on things that they're specially trained to do. Because we have doctors up on a I'm going to use the phrase, but it's not exactly what I mean. Up on a pedestal to the extent that, like, only they can deal with this.
They're a rent-seeking cabal.
Yeah, right. And so, if that is the case, what options do we have? Because I think this kind of wades into the tangible area where, like, if I say I want to try my best to influence how our government does A or B.
Yeah.
And like there's concerns, I think I mutually fall on concerns on both sides of the discussion about how things are managed and, how you go about doing things. Those are reasonable people who love people can have good discussions about that. But the question, I suppose, remains, are there things that we can do tangibly as members of community to positively impact those types of things so that they don't fall through the cracks? And so we can actually start making a difference from the bottom up.
Yeah, absolutely. And so, and I think a lot of that is about deconcentrating the power that doctors and hospitals have. Because there are a lot of, there are things that you can measure, like, for example, blood pressure. And there's a lot of great evidence that church-based blood pressure screening and the cardiovascular management programs. There's one called Project Joy in Baltimore that's been fairly well studied. That those are great at improving health outcomes. And then another great program in Baltimore is out of Johns Hopkins Bayview, and it's a community program where they have doctors and nurses in the hospital teaching members of the community, usually sort of respected members of churches, about basic health concepts that allows them to educate their own communities about different health issues, screen for things like blood pressure, blood sugar, and then sort of direct people into the healthcare system as needed. Now, I also think that on top of that, we can advocate for community health workers and nurse practitioners and other kind of parish nurses, other lower, not as extensively trained health professionals, to deal with stuff. Because there's a lot of, very simple, straightforward stuff that, fill up doctors' offices, but, you really don't need a medical degree, to treat them, and if things get more complicated, you can kick it up to a higher level. But I think that if you give people in communities who have a little bit of training more power, they're sort of they're living closer to the community level than a lot of doctors are. Although I also think doctors should be living close to the community level, but that's another discussion.
Right.
And when you don't have as much of that power concentrated in the hospital and the doctor's office, and with these highly paid, professionals, then I think you have people in the community going, oh, this is actually a lot more accessible and tangible to me, because here's someone who went to high school with me, who has gone to my church, that knows these things, and it's not this intense discussion with someone who has 12 or more years of school with me, but someone who I can relate to, that's talking to me about this stuff. And hey, maybe I do actually have a little more power about this over this than I thought.
So I imagine that one of the core barriers to that is a sense of fear, taking responsibility in some way or another with someone's health, by saying, hey, let me listen. No, maybe you don't need to go to a health professional, and recognizing that even doctors can't get it right all the time, right? They're going to miss something. Something's going to occur, and so I imagine there's a sense of fear among lay folks to even take responsibility from that type of training.
Okay, so to be fair, I'm one of the lay folks, right? So when he was talking earlier about, the guy that should have shown up, if you'd have shown up 5 years ago, we'd have caught this thing and your blood pressure wouldn't be so out of whack or whatever. And I'm that guy. I'm the guy that shows up 5 years later than he probably should have been in there. And then they're like, hey man, if you'd have stepped in here at any reasonable amount of time, we'd have gotten this taken care of. And the same thing would occur to me as going to somebody that is not a doctor. I'd be like, I know they only tell you so much, otherwise you'd be a legit doctor, which means that you're only going to diagnose within the information that you have. And so it would make me think that, if I have some kind of weird disease that only House could diagnose, this dude at the community center ain't going to know it, He's going to be like, you might have bone cancer, but I'm not sure. You're going to have to go somewhere else,
So maybe the question from that is that fear unfounded?
Obviously any...
I gave such a solid example, Matthew.
So there's, any time that you sort of decentralize the power, usually we worry about the fear from the other side that the doctors are, gonna not get paid as well and blah, blah, blah.
Yeah.
I'm not worried about that in the least.
There's a chance that people will miss something, but on the other hand, people find that, they've done studies that show, that doctors are, incredibly bad at reading evidence, and, there's certain treatments and things that, that there's a pretty well established protocol for, and, if you don't follow the protocol, then you tend to do more harm to patients, because you do tests that they don't need, you give them medications that they don't need. You end up doctors think they're smart enough that they can outthink the protocol, and so they guess at things, and it ends up being more expensive and harmful in the end. So hopefully we can also cut off some of that.
That's a good thought. I wonder how much of our medical cost, and probably tagged as waste, comes from the specter of something being worse, right? I'm going to do 4 tests instead of 1 because it could be this one thing, and I either don't want to get sued because I missed it, or the person is very afraid of it, and so to calm them down, I will do extra tests to make them feel better. And so not only like fear on the doctor's part, fear on the patient's part, like fear kind of drives maybe a lot of excess medical work, which then otherwise transplants down to me as a guy who said, oh, well, maybe I could be that. Maybe I could help people and know a little bit about it, but I'm so afraid that you're going to miss something big. But like that permeates the kind of the medical culture even beyond that level of thought, right?
Oh, totally. Yeah. Yeah, and I think sort of just finishing up the earlier question that I think when people in the community see that they you sort of see it in action of someone going to, say, a community health worker and getting something managed and saying, oh, so I don't have to go to the doctor for that. Well, that's simple. Or, oh, well, there's my neighbor and he went to the community health worker and the community health worker said, oh, well, you have this problem and this is beyond what I can take care of. So why don't you go to the doctor? And then they went to the doctor and got it addressed in a timely fashion. I think that will kind of decrease that fear, while also making the first point of contact with the healthcare system, as it were, much less stressful and more accessible.
Right. And I suppose it's able to, like, so as I was thinking through this, because it was one of the options, the things you had mentioned in the article, is there's a number of things that make it more nimble than the medical system, right? No, like everyone has this, even you try to schedule an appointment and you're like, they can't see me for X number of days and we're outraged. And that's so people go to the emergency room. We keep stacking up the emergency room with people because we can't wait. But we just don't have, the more things are spread out, the more communal they are, the more you got, 30 bodies on a potential area instead of 3. Things can move a little bit quicker. You can triage faster. You can just get stuff kind of separated out into the buckets of kind of the levels of care and the costs that are associated, and kind of know where resources are going, whether it be money, time, medicine, whatever.
Yeah.
And so, and you're right. I think the only way to change that is it has to happen. I don't think there's enough, propagandizing or education to try to convince people that they don't need to be afraid. Fear is kind of pernicious like that. Like they have to see that there's nothing to be afraid of. And I think the only way to do that is kind of persist in doing it until people kind of see the difference.
Yeah. Mm-hmm.
And so
now why can't you take that same concept and then place it in the structure that we have, right? Like it's the community part that creeps me out, right? Like the same guy that can't seem to understand that the license plate renewal sticker goes on top of the last one and he makes a border around the whole. Like he's the guy I'm going to go to and be like, Frank, you can't even get the license plate thing right, and now you're deciding whether I should go to the doctor or not. It's hard for me to get used to that.
Yeah, but you don't know that your doctor's not doing that same thing.
That's true. He could be the same dude.
He could be. Man, I have never been to talk there.
Wait, do you do that?
No.
Okay.
No, I don't do that that thing specifically, but plenty of other things.
Oh, sure.
Yeah.
So anyway, I think that feels real tangible to me, though. It's something that churches can do, is trying to find ways to be able to serve folks, and not only just like, hey, we're going to have a health fair or something, but I mean like committing to being that for the community, a place where we will host these things. We will continue to funnel people from our church through some sort of education program that knows these things. I don't know how many times I've told my wife, like, I just feel so inept. I feel like you could take, you took 3 months to change your life, to learn basic things so that you could help people for the next 60 years. And basically know the difference, right? Know that you just don't freak out because someone's got a red thing. Say, look, I've seen, what's the round? Ringworm.
Right.
One of the kids got ringworm and I don't freak out about it. It's like, oh yeah, it's just ringworm. Something like that.
Well, plus, I mean, can you imagine the number of people that are actually they go to the doctor merely for attention? I mean, this is what God's people are designed for anyway, right? We can shoulder that.
Oh yeah.
So I suppose
absolutely.
So that feels like something that I'll say this, I guess. So like, if we look at the broad conversations that go about healthcare, to a certain extent, we can start separating wheat from chaff. Right now, everything's in the bucket. Right? The person who just wants to talk to somebody, the person who goes to the emergency room because they have no concept of continuative care, even the folks who, and one of the things I was thinking about doing this on a communal or a church level with kind of the various tiers of educated folk, is that like, you're not going to be able to stop to immediately change the consumer culture that says, I actually don't want kind of your long-term maintenance things. I don't really want to eat differently. I just want you to give me something to make the headache go away, and so I don't feel bloated. Like, I just don't want to eat. I want to keep eating the Philly sandwich. So, like, that guy is going to continue to be a problem, because he's not buying into the concept, right? He's not buying into long-term benefit. He's actually consuming health products, and your committed community of folks is not going to be able to help deliver that to him because he doesn't want good advice. He just wants to cover up his lifestyle.
Yeah, but I would argue that if that attitude is going to change, it is far less likely to change in 15-minute intervals in a 15-minute office visit at the doctor's every 3 months, as opposed to a every other week at church kind of environment.
Oh, sure. Yeah, no, I agree with that. It's the best of your opportunity.
Yeah.
Right, but like, I think there is still, like, we've got boxes on the side of the cigarettes that say don't smoke this or you'll die, and we continue to do that. And like,
right.
Some of it's like chemical habitual. I get some of that, right? But like, some people will just make choices because they want to do it. And like, but the broad point of bringing that up was to say though, like, that's understanding that is the case for some folks, but not all, and there's ways to influence that. That's kind of wheat chaff stuff. It helps us understand what's really on the table, what's really costing money, what our resources and time are going to. Everything, like I said, right now is kind of just in this one bucket, and we couldn't even tell the difference because we're looking for the medical field to solve all the problems, like, and doctors to solve problems that other people probably could. Which I think you're right. Like, exactly. The cost of those things starts to look different.
Yeah. And I want to put a plug in here for a book by Dr. Daniel Hale. Unfortunately, it's a little tricky to find sometimes, but it's called Building Medical Religious Partnerships. And it's just has a lot of step-by-steps for various, for heart health, for helping the elderly with some of their more common health problems. Just really fantastic book that just kind of lays out all the principles and then has a lot of different suggestions and examples for how churches can do that.
That sounds pretty cool. Hey, your background, by the way, switched from crickets to birds. Did you notice that, Mike?
Yeah, I'm outside, so I don't wake up my children.
Oh.
While we're talking. So.
Oh, right on.
And the sun is coming up, and the birds are starting to sing, and it's very beautiful.
It always is.
That's but shoot, I'm completely selfish. I did not even consider what time of morning it was for you. That's awful. I'm sorry, Matthew.
No, it's no worries. It's every time, when I'm over here and I do a podcast, it's always what I have to do.
Just what it is.
Usually. Yeah.
Here's the thing, is I thought about it, but the guy at the community center said it wouldn't be a big deal, and to go ahead and call him as early as you want.
Yeah.
I was thinking about back to the kind of community aspect, churches and stuff. This might be too far in the weeds on this thing, but like, are there, you touched on this in your article, sorry, I've got like 10 premises to this question. And it has to do, again, with liability, right? This notion of fear, and people kind of standing in that position, taking on the responsibility. Do we find that people who are doing this type of thing, like, are they having to insure themselves, or like, is it just a thing we're afraid of, but something that's not really happening?
I mean, generally, we worked through this a little bit at my church where we set up like a counseling center.
Yeah.
And a lot of churches already carry, the same sort of insurance that if someone slips and falls in church foyer and bangs their head and, what happens? Can they sue the church? Like a lot of times the insurance they already carry will, cover these sorts of general things. Getting into the more difficult and advanced, like managing hypertension, for example, legally we're just not there yet.
Yeah.
Again, because of the doctor and pharmacist cartel. But I think that as those, if we can change those systems and kind of break up that monopoly, then I think then we can have systems for dealing with those sorts of liabilities as well. But right now, for the vast majority of things that churches are able to do, they can either sort of add a rider with their insurance or it's already covered. If they have, if they have a building of their own, a space of their own.
Gotcha.
Then, yeah.
Gotcha. So let me ask you this:
Yeah.
What is do you think there's any way? Is it enough to change it from the ground up? Right? Like, is it possible in your mind that if enough people kind of to commit to this type of thinking and orient churches and communities and things, like even if nothing happens from a governmental perspective, is it possible to kind of put that out of business on the top front by like trying to push it up, or do you feel like there's enough of a barrier that just can't happen?
I think, I mean, if every church in America sort of got on board with this, then yeah, I think that and it's sort of a chicken and egg thing, because I think if a lot of people in a lot of communities started taking more responsibility for their own health and managing their own health, that would really relieve a lot of pressure points in the medical system as we know it. And that would also motivate people to change a lot of the things that are inefficient and broken and unjust about the medical system. So yeah, I mean, I think that some of the government and policy barriers are things that drive the lack of responsibility, and that make life more difficult for people who want to take care of themselves.
Yeah.
But I think there's plenty of hope and plenty that can be done on that level, on the level of the community. And I think that would be really, really meaningful for a lot of people.
Because I suppose either way, right? Like regardless of how that conversation goes, right? Like, and the truth is, it might change by administrations, by congressional movement, budget, health, whatever it is, right? There's a million things that can push that back and forth. Regardless of where that goes, this makes sense from an overall health of the nation, the health of your communities, the way that we treat and love each other, moral goods and justice. Like, that's packaged in. We're just trying to reorient what it looks like to not be tied as if our personal choices in how we help our communities is explicitly tied to some of the choices that the government makes. It certainly is influenced, and it speaks to it. But like, to the extent that, are we using our freedom well, for as much as we want to talk about that, to positively influence society? That's a right question, regardless of kind of the political winds, right?
Yeah, exactly.
Okay.
Yeah, no, it's a problem that's going to be there, regardless of where our politics goes and takes us. And even if we do magically fix some of these higher level problems, it's still something that we're going to have to do to take care of ourselves in the world that we live in, and with just our current consumption patterns and health problems and things like that. Like, it's something we got to do anyway.
Yeah.
So yeah.
And so it was interesting as we've been talking here. I've been kind of cycling stuff through my mind on like, well, so what are the actual? This all sounds great, right? Like, so like, what are the barriers here? And it seems like there's a few major ones. Like, one of them is agreeing on what is on what is just, and and caring about it to the extent that we will, that I don't know, that you can even come close to holding a consistent moral line. Because one of the concepts when we talk about single payer, right, it tends to shift the responsibility of enforcement. Like either way, there's an enforcer. Right now, we're using major pharmaceuticals, hospitals, that kind of thing are kind of the enforcers of where our moral levels are when it comes to how healthcare is provided. You shift that responsibility to a government, and there's still an enforcer there. You're starting to meet, and I think you touched on this in the article, you're starting to meet basic levels of what you would consider just provision of healthcare. But the sustainability of any situation like that requires a moral consistency that I'm extremely cautious to put in the hands of anything that isn't that is that far away from kind of the base level of folk. Does that make sense? And so, it's a risk regardless of where you shift it. You trade some things and it moves you up. But at the core of all of this, how your community, even in the communal, part of the communal solutions, is a moral framework that says this is just and it is worth fighting for and is worth putting effort into. And to the extent that if we are a society that doesn't do that, it doesn't matter who the enforcer is, nor what opportunities exist if there's not an undergirding to that moral sense of responsibility and justice to people for their health. Am I categorizing that risk correctly?
I would say, yeah. Although I think the horse has already left the barn in some senses on that. Yeah. On that particular problem, just because we've, like you say, we've sort of delegated so many responsibilities upwards, that there isn't, I wouldn't say enforcement so much as allocation. That right now the allocation, is just a lot more, haphazard, because it's split up between these different forces that are constantly feel like the other one is screwing them out of their money. Right. Between the insurers and the pharmaceutical companies and the hospitals and whatnot. And at least with the government, the government may may not do that allocation very well, but it'll at least be consistent, and that will really cut down on the paperwork. No doubt. That's that's the kind of the cynical, worst case scenario. Because that's how it works in the UK. People that really, really need something get it, and then they're constantly squabbling about having enough money to do kind of the second order things. Right. But people don't go without something really important because they don't have the money.
There's a bit of utility there, right? So there's trying to, it's a net. It really is more of a net than a sustainable applauded system. It's just we put up something to keep them from falling off the cliff. Yeah. Yeah. Okay.
Yeah. Yeah, and it's there's different levels of choice. Again, it is about the trade-offs of what do you what do you want as a society? What are you willing to give up? And I had another post about 5 different ways to make the healthcare system more just. Single payer is one of them. It's sort of the simplest because it just sort of squashes everything down. But there's other ways to try to make to reorient the healthcare system. They're just more politically difficult.
Right. Yeah. Yeah, and so the tension there, I suppose, is if we don't well, there's a couple things going on. So one of the things is reorienting our understanding of consuming healthcare. So I was thinking about this, is that the folks who need it don't have the luxury, who need it right now, don't have the luxury of thinking about it that way. Whereas those who are paying for it and don't use it right now, then it becomes a value proposition, right? Am I paying, I'm paying X dollars, am I getting it back? Am I getting a good value, right? And so you will never get a good value in a system that is meant to from your if you don't also value the just part of it, right? Like if you don't find value in the fact that people who need help more than you do are being helped, if your sense of value doesn't include that, then you're never going to feel like you're getting a value out of the system. And so the single payer perspective forces that on you. And you don't really have the choice. The thing we have to ask, I think, as a nation, right? Like if we say that's not the right way to go because I think the government's going to mismanage it, or their notion of what is the net worth, like who needs care in this area or whatever, like whatever the specters are kind of in that thought process, is that if we believe that to be the truth, like are we actually fighting to do the right thing with our freedom, as opposed to saying, well, you're gonna have to take it away from me for it to happen, right? Like if there is a way to fix it on the other side, I don't know that we're putting a lot of effort into it to demonstrate it, except for to reduce cost for people who are looking for a better value, but that really isn't the core of our problem.
Right, exactly. Yeah.
And so
and certainly the current system has plenty of, people who, are paying in, well, more and more all the time and feeling like they're getting less and less for it. So it's, that's, do you want the insurers deciding the value, or do you want the government deciding the value that you get? It's,
It's weird because like people tend to, they don't trust either.
No.
Right, so then, and there's some credence to that, but then the things that otherwise move it toward, well, who can we trust? If we can start to trust to each other in some respects, or like things that are closer to home, and that's where this starts to fill a gap. And again, it comes back to like separating wheat from chaff. So when we start talking about the things that are actually on the table from a nation our size and the amount of people and the state of our economy and all that stuff, versus things that we might be able to handle communally, this at least, I think, helps to refine the conversation. That seems like tangible good news to me.
Yeah, totally.
Yeah. Okay. All right. Well, Mike, did you have anything lingering for Matthew?
I got to be honest, I'm the least intelligent man in this conversation, so I just kind of wait till things get to an ebb.
All right. Well, Matthew, I want to thank you so much for taking time to discuss this with us. I think this does point to, if good news changes how we see the world, and it says that we are to be the greatest in the kingdom, that we're going to serve, even at our own, that's going to cost us something. If we feel like we have personal responsibility to change the lives of our community around us, to use our influence the best as we can to make the most of the opportunity. The types of stuff that you're talking about, I think certainly points us in a direction that says we have the ability to be effective in tangible ways for our community, even in a medical space where we feel unqualified. Like there's ways to bridge those gaps that aren't crazy monumental. And so, so anyway, I want to thank you for your voice on that. I want to thank you for taking time to talk to us about that. And obviously for the stuff that you're doing, best of luck in your teaching position, and continue to positively influence folks in that area.
Well, thank you so much for having me on.
You're welcome. All right. Well, have a good night.
All right. You too.
Bye-bye.
All right. Bye.
All right. That was Matthew Loftus. What happened? What was that, Mike?
I gotta say, I mean, I think I kind of half understand what y'all are talking about, but there's a lot of big words being talked about, and like philosophical things, like the weight of things and net gains and whatnot. And I think to myself, boy, I just wish I had the faintest idea. I drew a tree with a beard on it while you guys were talking. I had a tree and I put a beard on him and he was smiling because I'm like, here's like in the long run, I think what you guys are talking about is it fits the exact profile of what we're talking about, right? Like we're talking about, does the good news of Jesus Christ change the world? And he says, yeah. And here's how it's done from a guy that knows medical stuff. Yeah. Blah, 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 blah. It's just the same thing that Jesus set up, right? I'm going to set you up with a community. I'm going to give people some things to do. I need you to parlay to them. And then that's what we're going to do. And like ours especially has gotten so screwed up. Like it makes me pine for the day of, like small town doctors. You know, where there's like one dude in town and like he keeps track of your entire medical record. He's known you since you were a naked baby and now you're 50. Yeah. And then he says things like, "No, man, it'll be fine. I'm not giving you any pills for that. You know, stop being a whiner. Get out of my office."
Yeah.
Like, I miss that guy. That's the guy that I want. And I suppose I would always be distrustful of your community man. You know what I'm saying? Because it'd be just like everything. Because the hospital does the exact same thing, right? Like, they try these small sub-programs where put them through like a 3-day seminar, and then they're like, "Hey, we're gonna talk about fibromyalgia health." And then they put on a clinic, and it's people who had 3 days worth of training, and they're meant to, it feels like they're meant to try to keep you out of here, right? Like you're showing up.
They are.
Yeah, right. You're showing up to come into the hospital, and they're like, "This is the front line of defense to see if we can't get some of these people not to come into this hospital because we don't believe they have this anyway." But like, it feels like they're completely shining you on, and I'm afraid that's what the community thing would be.
You're right. So that was kind of what I was getting at, though. Like, it presents this thought that like, there's an individual thought that says, yes, the normal procedure works, but not me. I'm a special case. There's something actually additionally wrong with me, or there's a nuance in my case. And that's what he was. So that belief, though, says I only should see experts.
Yes, I deserve the best.
Right. So, but it's the wrong definition of the best. Like, and maybe I'll follow up with him and see. It'd be interesting to read some of the studies, right, where he said like the doctors, for fear of that or for whatever reason, because they think they're more wise than following the basic treatment, end up causing more issues. Because more often than not, it's actually, if you just followed the protocol, you'd have been fine.
Yeah.
And community folks can do that. So like, I do think that is a legitimate barrier. It's difficult changing people's minds where they say, look, I just don't trust this situation. How can you? I want the professional. Like, we've kind of elevated professionals. Think of it like, think of how many people pay other people to do their taxes. I need the professional. And like, I've done my own taxes. Yeah. It is not difficult to do my taxes.
Well, I think like at-home birth is probably the best example, right?
Yeah.
Like it can be done. People have been doing it for centuries. But like dudes like me look around and say, look, I'm pretty sure it goes fine. But in case of trouble, I want that man with a coat. And I want this building with the machines in it.
Yeah, right.
That's what I want.
Yep, I want the room full of all the equipment, and just in case something happens. And so, like, the thing is, and this is the hardest part, is like, it's the stakes are so high. You're dealing with someone's life.
But here's the thing, and this is where it shouldn't be so high for us, where Christians should be jumping right into the stake, because I'm like, what if I'm wrong and I die?
Yeah, right.
You know what I'm saying? Like, I mean, it's not like the Lord's going to be like, you idiot, you know?
Right.
It's like, you coming in either way. And so, what am I really worried about? That someone going to make the one wrong decision, and I end up dying of pneumonia or something. I'm like, okay.
Yeah. I mean, maybe. And so, like, and that was one of the things he touched in his article, is that how much we pay subspecialties. So, like, not the primary care doctor, and not even like the high dollar cancer man, but like he's a cancer that only comes from a fungus on the belly button or whatever.
Yeah.
And like, that guy makes a ton of money.
Big belly button cancer man.
Right. And so, and maybe, and so like relative to what we pay, we are able to save and help a lot of people in those niche things, but it's coming at a cost to our maintenance, our ability to, have people have consistent health care, and do things that aren't chronic. But the trouble with this is, and I don't think I got to the finer point here, which is, a lot of the stuff, like our major medical things, they seem to be lifestyle choices. And the question, I suppose, which would be interesting to bear out, and this is kind of what he got to, he said that going to the doctor, you got 15 minutes with the doctor, is that more likely to change the fact that you are a pack-a-day smoker, versus you're continually seeing someone in your community that can get to know you? Are they going to be able to have a greater influence and convince you to stop smoking?
Yeah, I mean, it's definitely B, right? It's definitely community man.
Yeah. And so like, if we reorient that to say, have those types of conversations at a level, like, you're never gonna, you ain't gonna see your doctor every 2 weeks. There's no way that's gonna happen.
Yeah.
And I mean, I'm not going to the community clinic every 2 weeks anyway. I don't have any reason to. I haven't been to a doctor in a decade.
That's what I'm saying.
But like, but actually, so the part of the reason though is because I have various people around me that aren't doctors, but they're close enough. And like, for basic, I've not had major health things. I got headache problems, and they're like, are you eating like crap? Are you, if you got stomach issues or whatever, like, they go through basic understandings of how the body works. I'm like, well, actually, yes, I have. I'm not sleeping well, or I'm eating terribly, or like things that are my environment, or you got stress or whatever. People can pick these out. I don't need a doctor for that. and it continues to work. I'm still fine. And so I suppose that's the question: is do we have can we create the infrastructure to do it? Like, think about what it would change, right? If you knew the thought process of the town doctor. Our towns are, let's say they're too big. There's not enough doctors to fill up to take care of a town like that. All right? But like, if you could handle 70% of basic medical care because there are neighborhood people who've gone through whatever training we feel like is appropriate to do that, like, that gets you a lot closer to that aspect.
Is it free?
Well, probably.
People are volunteering their time or something?
Well, they could be. Here's the deal: is like everybody I know that has kind of that healing mindset. They're constantly answering the phone, right? They're not dodging it. They don't. They literally want to help people, right? And so I think they would. I mean, whatever, you can figure out a structure to pay them. I don't know if it matters, but like,
I mean, you gotta, there's just seem like there's more of a cost involved, right? Like, okay, so let's say you get people coming to your free clinic or whatever, like, yep. I mean, you're gonna have to have paper on the bed so they don't get their nasty bum germs all over the place. You know what I'm saying? Like, you're gonna have to have sterile stuff, you have to have gloves, you have to have some high-end temperature equipment or whatever, you know what I'm saying? Like, it's gonna be a small clinic.
So does a communal meal to the homeless. Everything costs money.
Yeah, but it don't cost money like that.
You're gonna give something away, it's gonna cost.
I hear what you're saying, but like, it doesn't cost something like that. I can make chili and hot dogs for under $100 for probably 200 people.
Gloves are cheap.
Now you say that now. Wait till you buy them by the caseload, and you wait till you see that bum paper.
Yeah, I don't know what you're talking about. No bum paper.
Yeah, that's stuff that has to go on the bed. The blue paper.
I don't think you have to do that. No one's getting naked at the community clinic and put their naked butt on something. It's stupid. So, and there's I think there's right questions for like the measure, right? Of like, at what point guy shows up, he's bleeding, he needs to go to the doctor. There's no reason to come in here. But like, someone sprains an ankle, can somebody wrap it? Do we got someone around here that knows how to wrap an ankle?
Yeah, but how you know it ain't broken?
So here's the deal: the Army does that. Like, most of the guys in the armed forces have some basic training about stuff like this. They can help with
yeah, but we're not field dressing a wound in the middle of a battle. Like, I mean, they're going to want to get an X-ray to see if it's broken.
Yeah, I know. Are there ways to tell that here's the deal: could people pick out a broken bone prior to there being an X-ray machine?
I don't know. Yeah. I wasn't alive, Ben.
Yeah, so I think it was possible.
Okay, says you weren't there either.
You're right, Mike. The people were potentially breaking bones in Austria, and they said, we don't know what to do.
They
put everybody in casts.
Yes, they probably just set them all. Everyone. They said, I don't know, something wrong with the foot. Set it up.
You're stupid. That's not right.
You have no proof that is not the deal.
Not what they do. So
I'm going to check on it.
Okay, so from your perspective then, are you saying this doesn't... For you, it's not enough. It's not tangible good news.
No. Here's the thing. I think it's a great idea. I think it's a great option. Your biggest hurdle is guys like me, where I'm like, I just don't see it. You're right. I believe I deserve the expert. Like, I mean, look how much healthcare money you've taken from me. I want to see a guy. Give me a guy.
So I think so. There's two levels of question here. There's one is tangibly helping people who cannot afford it. And they may go to this simply because it's a better option, right? You have the luxury to say, I want the expert. They may not.
Yeah, they have the luxury to steal my money.
They might.
For the expert.
Who?
It's not a luxury of anything.
What do you mean?
My health insurance company.
It's
right. Not like I'm like, give me the upper crust healthcare plan. They're like, give me $2,000 and we fine you.
Right. So I get that, but like, that is not the same as someone who doesn't have the option to see the expert, right? Like, everybody can go to the emergency room. Not everybody can go to the expert.
Sure.
So to that extent, I mean, I suppose I would say this is not for you, but if it isn't for you, it probably doesn't change the game, right? Because if you're then it's just charity work. And that doesn't actually change the system. It doesn't change how people function. It doesn't change how people get heart disease or that kind of thing. Like, or as long as the smoker is middle class, they only get the 15 minutes with the doctor. They're not going to the community clinic.
All right. So, but here's a pro in the right direction, right? It's like I felt the same way about, say, essential oils 2 years ago. I'm like, no, yeah, these are dumb. No, right. It doesn't make any sense.
Right.
Right. I've cured everything. I have. Folks around me have cured everything I've ever had wrong with me in the last 3 years with essential oils.
Right.
And so, like, I don't go to the doctor either. So, it might just be like it's just going to take a little while to get people on board with this, and checking the thing out. But the part that I don't like is I can see the benefit for, say, the folks that are continually going into the clinic or something. They're actually paying out of pocket to go. Like, the people that can't afford to go anyway, doesn't really matter. They're going free. right? Like they're basically just dumping the costs on the American taxpayer, and it's getting paid for anyway. And so, in the long run, like you're talking about the guys that are actually spending money on health care, and to me, the benefit looks like maybe they're getting more palliative care. But on the backside, he was saying that maybe the hospital would unclog a little bit because of these, there wouldn't be near as much, unnecessary traffic.
Yeah.
And if that was the case, I'm like, I don't want to be benefiting in no hospital. It's not like they're going to lower the prices as soon as it's unclogged.
So what's interesting is that would be actually the capitalistic, the capitalism answer, right? Is that it should happen. Is that they should lower the prices.
But they won't.
In effect. So if they won't though, that means like that's crooked. Right? Like that's not a
Are you insinuating we don't have enough proof that it's crooked now?
No, right. Well, okay. So if that's the case though, so they've got you by the nuts, Mike.
Right now. Yes, here and now.
You say you're crooked, but I don't trust anybody else but you.
It's like buying gas. Yeah. You see a storm roll through the south and they're like $2.85 a gallon. Storm goes away 6 months later, they're like $2.90. Things are back in production. Pipeline's been open for 6 months. Same price. And you go, I feel like it should have gone down a little bit. But it does not. It does not move.
Right, but you still pay it. Because you have to have it.
Because I have to have it.
Right. Wait, let me ask you this. Are you more likely to buy gas from a man manufacturing his backyard versus taking medical advice as to whether you need to see a doctor about your cough?
I mean, this backyard refinery, man, seems interesting to me at least.
So I think you're right. I think it's the right question, right? Because we just don't trust people. We have the luxury to have that. Like we are able to do that. We are able to say, I don't trust you. I want better. So take the charity case off. People who can't afford it, they're going to have to take what they can get, right? And it's money from beyond that funds the system. And so the question is how do you convince people that are funding the system to stop funding this? Like if they say they're not using my money right, why? But they're not open to the option of having kind of the various levels of care. And it doesn't even have to be a layman, right? Like you're talking about empowering nurses and nurse practitioners and like not being so sketchy about folks like midwives and like one or two steps underneath parish medical professionals or like whatever. I mean whatever. Also, let's start sending people to school. Like they don't need to go for 7 years. They're not going to see every instance. Like do an associate's degree in something, right? Like It's not like you're not training people. It's just saying we're gonna find levels of folks so that like we can do basic things. I mean, can we give away? What if I went through a paramedic training? Is that enough for me to be able to be okay to do basic things to people from a church perspective, to have them kind of run through and do a clinic and then say, look, that's beyond our care. We'll recommend you to go do this. And they can get you in sooner because you're not clogging up the system.
Yeah, I mean, but he's right. I mean, you know how grand of a scale that would have to happen. I mean, look at every major city from here to Tacoma. Mm-hmm. You know, like I mean, they are littered with giant hospitals with thousands of beds and tens of thousands of people working there. Like they're like a juggernaut of an institution. Right. And like what you would have to do to not only to decrease the amount of folks going in there, but change the mindset of the folks going in there. Like if they believed in doing this stuff, they'd do it now.
Well, so I think there's two barriers to that. One is I agree. I think we are very consumeristic from a health perspective. I think I don't want to listen to a guy to tell me to change my life. Maybe I just want the pill. Heck, I know a lot of people that are like that. Right? They just don't want to they don't want to change anything. They just want the quick solution. And so like I think there is some optimism that says if they come to the community thing, I think your chances of influencing them are better. But like I think there's still sin in the world. Like people are still selfish and people still will take the short-term answer. And I think we for all the people that are actually in need and that want a difference, I think there is a blindness that says that there are people that simply don't. They don't want the difference. They actually just want you to give them the medicine and send them on their way.
There's a large amount of that.
Yeah, they don't want to eat differently. Now, again, the thing is though, is I can't speak to what it is on the charity level, like the people who actually can't afford it, but that exists all over the place from a middle class perspective, right? Like people who do have the means to do it differently they just don't want to.
No, that's very much true.
That. And so I think that's true. But I think you're right. The second thing is that we have they're not doing it on their own because it feels like a significant jump. Right? Well, for the same reason that you're saying, right? Like if I started that up, you ain't coming. Because you're like, I'll just go to the hospital.
Well, see, and that's the thing. Like, it's just one of those deals. You got to know a guy that buys into it, right? Like, I don't use no essential oils until I meet somebody that already does. You know, I mean, same thing for folks that do, needles in the face or whatever they do.
Oh, acupuncture.
Acupuncture, right? Like, I'm like, no, that's dumb. I'm not doing it, right? But I mean, I met a couple people that are like, yeah, it helps a little bit.
Yeah.
I would consider it in some areas, you know? And so, like, it really is just about exposing people to it and giving them a chance to give it a shot. Like they're not going to move on their own because they're going to feel like they're getting slighted. Like I paid for the hospital. My health insurance money pays for that hospital and that doctor to be there in his sweet parking spot. When I'm sick, dang it, someone's going to come find me.
So that is, think of it this way. That is the problem though. It's health as a concept of value. And this goes to the core is, Matthew would define a just healthcare system that basically doesn't allow people to fall off the cliff. That they're not dying of something unnecessary, things that could have been prevented, right? And so if we don't agree on that, and that is something that is worth paying for, nothing will change. Because I'm never getting the value out of my healthcare. I spend a lot of, even if I get it through insurance, but here's the thing, they always talk about that. I'm paying for it. Now my employer's paying for a good chunk of it. But it's not like I'm not paying for health insurance, okay? So like in a given year, let's just say my health insurance cost me $2,500. I don't go to the doctor. I buy vitamins, and those aren't even like, it's not like medical insurance covers that. And frankly, and this is one of his things too, is that the HSA doesn't either. I can put money back for an HSA. I can't buy preventative care stuff. I can't buy vitamins. I can buy medicine, but like I can't buy things that keep me from getting sick. You should be able to buy a Y membership or something with your HSA money. Yeah, or fruit or whatever, right? And so you can't eat better with HSA money. And so the truth is that like I'm not getting a value if I think in those terms out of my insurance. I've paid $25,000 in health insurance premiums over the last decade for me and my family. And I have gone to and that's a high deductible. I've never ever met my deductible, and I've probably paid in another, I don't know, $3,000 or so out of pocket for various medical things over the last 10 years. And past that, I've probably spent more than that on vitamins and fruit. And so the thing is that like, I could look at it and say, hey, I'm not getting a value. But the truth is, insurance only works, across groups if there are people that are not getting value out of it. Right?
Yeah.
Like, that's the only way it works. Because if I was taking out more than I was putting in, and so was everybody else, the thing is bankrupt, right? So insurance is that safety net, and I have to be comfortable with the fact that I may not use it, that I may not get the full benefit of it. Like just because the opportunity exists that they will pay for my arm to get cut off doesn't mean I'm missing out that my arm didn't get cut off. I'm paying so that it's covered if it doesn't happen. That's the nature of insurance. And so if we can't agree that there is value in me overfunding a system that I don't, because my arm didn't cut off, but it went to somebody who didn't pay as much, but whose arm getting cut off was covered, if that's not okay with me, like, then we don't have a moral level to otherwise make right decisions. You understand what I'm saying?
I don't think that people are in agreement there.
So they have to be in agreement. That's our current system.
Oh.
Right, so like is
it though? Like the guy, my arm doesn't get off, but like, I ain't talking to a bunch of people here lately that are like, you know what? I'm so impressed with my healthcare coverage. I walked in, I thought it was going to be a total onslaught, and it turned out they covered just about everything. It was great. I mean, everybody I talked to, like my eczema medicine used to be $5 copay. Now it's $300. But you know what? Still got eczema. Still gotta have it. The only stuff that works.
No, yeah. So I get that part. I guess that's what I'm saying though, is like, when it comes to our society, if it's only about me, then I'm getting ripped off. Right? Then I feel like I'm not getting a value because I didn't get to use my health insurance to the full extent. But that's not the concept of insurance. The same thing, think about your car insurance. Right? Like I pay car insurance so that if I get in a wreck, they will replace my car or pay for the repairs. Right? I have not wrecked my car in the last decade. And so, am I getting ripped off from my car insurance?
Yes.
No.
Oh.
Because they would have paid it. I'm paying for the opportunity. I'm paying for the backup, right? But like, it's not fair to then come back and say, yeah, but I haven't wrecked my car from 10 years. You stole my money. They still had to be prepared to cover that. What did happen though is somebody bought insurance, paid it for 4 months, and then wrecked his car, and they bought him a new one.
And you're saying that the swings allow them, to be able to handle that as such an emergency.
Right. That's exactly right. Like if you want to know that you're getting the full value out of your money, you're gonna have to put it in your drawer, and then you know that your $200 will be used to its fullest extent.
See, that's what Ted Nugent said to do, and everyone's like, "No, Ted, crazy."
No, because he is crazy. Because what's not reasonable is that you're gonna wreck your car, and your car's not $200. Only a fool would pay you $20,000 to replace your $20,000 car when you only paid him $200. That's insurance.
Yeah.
Right? Like that. So here's the thing. If we can't agree that that's what insurance does, and the conversation says I'm getting ripped off because I'm not getting my value out of it, like you don't understand how insurance works. It is a group pool. It's not an individual item. I'm not giving you $5 for $7 worth of goods and feeling like I got a good deal. That's not what's happening. You're agreeing to share risk with a very large pool of people and have it spread out. Now the truth is you're doing that from a private insurer today. The single payer option says, we don't like the way the mess that comes with the various private insurers, the corporate hospitals, and all those things. We're only going to negotiate with one insurer, that's the federal government, and then that will at least get rid of a lot of those things that are clogging the system. Now, I don't like that because I don't trust the government to do it right. And I think that most single payer folks will at least admit that like there are inefficiencies in the system, and they're probably not going to do it the way you want. But like one thing you cannot argue against from a single payer perspective is this thought process that says they're going to redistribute my money. All insurance redistributes your money.
Yeah.
All of it.
Yeah.
Right? And so now you're just arguing who you trust. I trust neither. Right? So then the question is, how do I solve this if I don't trust the big party that makes the big promises? But even though it's all going to shake out the same for me because I have health insurance and they will cover it at some point or another. So the communal aspect starts to shift the conversation. It starts to say, all right, how can we take some of this? All that money have to go into the system. If money kind of corrupts and otherwise has an unwieldy move and doesn't even cover the things you expect it to, I would have been better to keep the $200 in my drawer than pay this guy $2,500 for him not to have my copay and then spend $200 extra on eczema.
Like Nugent said.
I don't even know what Ted Nugent said, but like
I just don't.
I accept his exact quote. So anyway, so then the question is it like, why am I paying $2,500 a year in health insurance coverage if they're gonna give me a $1,500 deductible and I'm gonna have to pay $200 for my eczema medication that they're not gonna cover anyway, right?
I agree.
And so the question is that like, are there things that I can be done on a more preventative care maintenance schedule? Maybe I say the HSA is designed to do.
Yeah,
this
but wouldn't you'd have to say, if we want to get all the nitpicky fellas out the door, you'd have to say that the health insurance company is losing money on these people for that to matter.
Yeah.
So like on the whole, it's not the cancer patient that's $1 million treatment. It's not the heart transplant guy. It's the masses that are showing up there for not feeling rights. And if we could weed those guys out, so the insurance companies aren't dinging the doctors aren't dinging the insurance companies for all those visits, are we trying to say that like they in the long run they're losing money on the nitpickers, on the guys that are in there frequently?
No. So it's not a single source of the problem. Like that's what makes this feel like it's too big to solve, because it's not that if you pull some of that out of the system, stuff doesn't automatically get cheaper, insurance doesn't automatically get better, right? Like we have to rethink how we do care. Like I need the car insurance if I wreck my car. The question does that make sense that we have something in place that says there's catastrophic insurance in case major things happen and everybody's covered? Like are we willing to pay for that if we can find better ways to deal with the persistent costs of the nitpickers? And can we otherwise reorient people's lifestyle so to try to improve how often those major things are happening, right? Like, can we move 100 lung cancer out of a population of 500 down to 50 because people are actually giving up smoking? Or if heart disease is our top killer, if people are eating better, if people are spending money and exercising and that kind of thing.
Is that what that business wants? It doesn't actually feel that way, right? Because otherwise they'd be addressing the problems as they sit right now.
No, it isn't what they want, but it's what we want. right? So like, I don't want to pay them $2,500 a year for them not to cover anything. Mm-hmm. I'd pay them $500 a year, relative to my risk of coming into something that's actually catastrophic. Although then again, that's me like looking for value out of the system. But like, there's multiple things. There's like 5 big major things that have to change for you to reorient the conversation. Like the thought that there's one thing that can shift and it changes the world is a lie. Like that's what's not going to happen. And you're right. The insurance companies aren't necessarily motivated for you to stop coming in and doing work and like getting medical care. They've got a largest of things put together to do that. I think the question is that like, are we overspending? Are we paying a doctor, for example, $200 an hour to diagnose a cold that like someone with 3 months of paramedic training could do?
Yes.
Yeah. Right. So like, when we look at our economy, is that a good use of our resources? Is there a better thing to do?
But for a majority of people, it's a wash of a cost anyway. I don't pay out of pocket to go in there and have a doctor diagnose a cold. I mean, we're talking about differences that are going to show up, in 15 years if everyone else goes on board. Otherwise, I'm just the rogue not getting professional medical care.
No, right, but so you didn't pay it, but it got paid.
True.
Right, so somebody paid it, and so like you did pay it, like you're paying insurance premiums.
Yeah, but I mean, it's not like if Lone Wolf decides he ain't gonna go in there, my insurance premium is gonna drop tomorrow. No, it's gonna take 15 years and another million people to do it.
Right, so that's true. So like it's a long game.
Yeah,
right?
It's a real long game.
It's a very long game and that's the truth is like, I don't know that we have society that we have the stomach for a long game. Right, that we are looking and saying, how do we fundamentally change how we think about healthcare? How do we make sure that people aren't falling off the cliff unnecessarily? Like, here's the thing: where does our pro-life stance end? I don't want babies to be killed, abortion. I don't want assisted suicides. There's people who could, if they could have gotten care, and I think the examples of this may be overdone, right? But like, if people exist who could have gotten care but simply didn't because they couldn't afford to go, is that acceptable for us from a life perspective? If we could have influenced that, should we?
Well, yes.
So as you reorient, now start backing that up and saying, if some of that is lifestyle and you can positively, people aren't going to hospitals for lifestyle changes because those are events. I go to hospital, they give me something, I leave. Versus actual community influence, are God's people on the hook for that type of thing, even when it comes to healthcare?
Yes.
Okay. So that's the question: is for all the long-term impacts and our broad attempts to change a system. I wonder if like some of these types of solutions, these communal types of solutions, are done anyway, are simply faithful in the means type of exercises that say, anytime that we have the chance to shine the light of Jesus to community, to serve them in one way or another, to attempt to positively change their life, to get close enough to them so we can recognize where the needs are that the systems won't meet, that we can meet, and to basically move knowledge and influence down into a church level. Is that not something that we want to be a part of, even if we cannot predict how much or how far it will influence the broad issue?
Sure.
So I think for me that's how this still changes the world, because I don't know that I can be responsible for solving the nation's problems, but like, can something like this help to positively influence your community? I think the answer to that is yes. And so to that extent, because it's within our tangible control, maybe it's something that you can do. That feels like you can make, as opposed to just saying, I voted one way or the other. Like, your vote is a little bit of the thoughts and prayers category, right? Like,
I feel like you want something like this to work, you just actually have to just do it and then let it start affecting people, and then it will go on its own. You can extol the virtues all day long, but until someone else hears someone else say, yes, I did it, and yes, it's going to work, all I see is that you're taking, like, you're still taking my insurance money. I'm just not getting to see the guy that went to school for 12 years. I'm just seeing the guy that went for 3 weeks.
Yeah. Yeah, right. So like, this is not likely to catch on if you're otherwise also paying the same insurance premiums all the time.
Which for it to catch on, that's going to have to be true for a while.
Yeah, so that's true. I think there's kind of like the insurance companies and hospitals and all that stuff, like, they're not going to change that structure Like, why would you? Nobody goes through and like automatically start. In fact, I've never had a lower insurance premium ever.
No, well, and watch them, right? Like, let's say this whole thing fires up and flips the tide. They're going to be like, hey man, demand's way down, and we got big hospitals to pay for. Our insurance rates are going to have to go up. You're going to have to pay for all these people who work here, and the building's got to keep the lights on.
Yeah, so like there's the communal aspect of that too, right? Like if you start to move that stuff down, and you start giving stuff away that people are getting paid to do now, yeah, right? Like there's a community, just like there is like...
Here's the truth of the matter, though, is like you might see America's economy turn back to service, or get off a service economy, and we start making things. You know what I'm saying? Like you take some of that stuff out of the hospitals. I actually have the same opinion on some of the bigger churches, right? Like if you take some of the positions that exist that are actually just service positions, they're just you serving people, and say, look, that's not your job. It's just how you serve people, and then go find something to make.
Yeah.
You know, and then I think you would see parts of our economy that would have to turn back around and say, look, we got to produce something. We can't just service ourselves. And the healthcare industry and the clergy have the most room to negotiate on people having, you know, a chance to be part of an economy that's producing something.
Yeah. And you know, one of the things, and I meant to ask him about this, is like when he was talking about the broader definition of health. You know, talking about spending time with people on back porches, right, and reorienting how cities are built and that kind of thing. Like, one of the core barriers we probably have is like, do we actually value that, right? Like, can you convince people that it is valuable to know your neighbors, to engage with people, to not be by yourself? Like, some people will feel that, but like, I actually think that is something that you actually, similar to the care. Like the communal care type stuff, that you actually have to convince people that it is valuable. And if they don't find it valuable, they're not going to change it. And so unless we agree that there is a value to it, from a health perspective, our society is not going to be able to move like that. And you're not going to be able to force it. And so I think one of the barriers, frankly, is what people find morally good. Or what they find, not morally good, good for your health.
Yeah.
Because they'll look at this and say that's bogus. For the reasons he mentioned, right? Like there's nothing to measure there. Is there quality of life indication?
Yeah. So really, it just goes back to the same thing. You're gonna have to fire it up, and you're gonna have to get people interested. And even if you got to do it one by one, and start talking to people about, hey man, we got to talk with each other. We got to go out on some walks. We got to stop eating this garbage, whatever. And then like before you go hauling to the doctor, let's talk about it. I think that's solid.
So yeah, actually, so final thing on that then, like you can do that, even ignore the church sponsored stuff and community level things. Like you can do that with your friends, right?
Yeah.
Like one of the examples in the article was in Japan. There are guys who just did that. They just are intentional about having groups of people, and they get together and say they check their blood pressure and they talk about their health stuff, and like they're comfortable that the group wisdom is sufficient to otherwise catch things and maybe say, okay, now go to the doctor, or, you know, I had that and stop eating liverwurst or whatever it is. You know, I suppose we just don't trust the knowledge. You know, hey, we should drive through the hospital parking lots where the doctors park and see how many guys have them stickers up. Cause think about that. Like, think about the guys you don't trust, and then that is the doctor doing it. The guy cutting you open.
Well, and actually we've talked about this before. Like, I mean, it's not like they say only the top 5 out of this medical school graduate.
Yeah.
They're like, if you got passing grades, you graduate. That could be the top, 85%. And I mean, that dude'd be a C student. He's out there.
Yeah.
Cranking on people.
Yeah.
I don't know about that.
No, right. But that's what's happening. And you wouldn't know it. He didn't put the C on his name tag, so you know he was the lower tier.
No. Yeah. I mean, they put him in the same hospital. Like, you wouldn't know the difference. The guy with the low rent auto shop, he's spray painting on plywood. And you're like, nope, not today.
Right.
Give me the lighted sign. But that guy that made C average or whatever out of the medical school, he working on the 3rd floor. And that's all I know.
Right.
Yeah, something to keep in mind there.
Yeah. All right. Anyway, hey, I don't know. I kind of want to ask for your thoughts. If you guys have any feedback or whatever on the interview, shoot us an email, info@livefromthepath.org. Yeah, I don't know if I can keep up a sustained conversation on this stuff.
I don't know. It's a slow burner, Ben.
Yeah. Well, that's a long time.
Yeah.
Yeah. All right. Most of that was me. Shoots case. All right. I don't know. We got time for one?
No,
we don't. We're done.
No.
All right. Hold on. I was expecting a Dear Live from the Path, so I don't have a.
Hold on. Yeah. Well, we got time for one.
Okay.
Advise a guy that stinks. We got to do it.
Okay.
Dear Live from the Path. My husband, quotes Ron, and I have been married for 49 years. When we retired, we moved to Florida. Ron is 71 and healthy. He rides his bike 30 to 50 miles every day. He also mows the lawn and takes care of all the gardening. Problem is, after all that activity and the heat and humidity, he don't bother to shower. He'll just change his clothes into whatever he wears for the nighttime. I've spoken to him about it, but I can't seem to get through. My 3 sons, 47, 43, and 42, don't want to speak to him. I wonder if that's their names.
What?
Ages. My 3 sons, ages 47, 43, and 42, don't want to speak to him about it because they don't live with us. For them, it's only a temporary problem. I'm at my wit's end. I am sensitive to odors, and it has gotten to the point that I want to move out. Please, can you give me some ideas on what to do? The air fresheners I bought for his room are not enough.
This was the husband?
Yeah, Ron.
What the heck ever? Just talk to the man.
49 years worth of marriage to Ron. He stinks. He stinks bad.
No one's willing to say, hey, Ron, you stink?
30 to 50 years? I wonder how she's putting it. You know, like, is she being straightforward? Like, Ron, you go out ride 30 miles today and then you mow the lawn? You smell like an armpit. You can't just put on clothes and I expect the clothes to smell like an armpit too.
So wait, I missed the first. She's talked to him and is just not making any progress, or she wants her sons to do it.
Let's see. The problem is,
my wife would say that to me, in fact, does say that to me in a hot second.
Yeah, I have spoken to him about it, but I can't seem to get through.
What do you mean?
I would hide his clothes. I'd put them in a locked cabinet. And I'd make naked Ron toot around the house, and you say, Ron, no clothes until you take a shower.
Yeah, take a shower. And no times. We're not spending times. You stink.
She didn't make any mention of the times.
I mean, how do they get 3 sons if he stinks so bad?
What kind of weak-livered sons are these? Like, this is a perfect problem for a son to a dad.
Yeah.
Right? I mean, the mom gave it a shot. She tried to talk to the dad and say, look at Ron, you got to shower this up. And he's like, woman. You know, but like I would tell the son, and I would send the oldest boy in there, and then he would go, Dad, listen, you smell like bum.
Yeah.
You got to take a shower. You can't be out doing all this jazz, and this whole house stinks.
Yeah. Yeah, that doesn't seem all that difficult. I would say that's certainly,
I'd do this without even meeting the man. I wish they'd included a phone number. I'd call Ron directly. I have absolutely no problem with this conversation. It's just a one human to another human conversation.
Yeah.
You, friend, smell terrible. I think you should do something about it.
Yeah, you just gotta talk to him. That's silly.
All right, Secular says, you say you've been married to Ron for 49 years. Was he always so slovenly about his personal hygiene? If it's recent, this may be something that should be brought to the attention of his doctor. She's gonna think it's some kind of mental illness.
Hey, this is what I'm saying, Mike. Community.
30 to 50 miles a day?
Yeah, he stinks. This is not some sort of illness problem. Listen to this. Okay, this proves the point, right? She's going to send this man to the doctor because his wife can't convince him that he smells bad.
That's not a good reason
to
to
go
to
to
the
doctor. This is not
doctor.
a medical problem.
They need to stop at the community center with Ben. Here's the rest of the advice. As people age, their senses of sight, hearing, smell start to become less acute. There's nothing wrong with those senses. Could he be developing dementia? Frankly, that was my first thought after reading your letter. See, you haven't had any training. If it's not the case, is it possible that his poor hygiene is intended to keep you away? If that's the reason, then you have 2 choices. Give him an ultimatum or write it out. However, if you do the former, you must be prepared to follow through and accept the consequences. Hey man, you have caused a rift in a marriage that didn't need to be there with your precocities. You know what I'm saying?
Ultimatum.
Yeah, I mean, seriously, you going to end a marriage of 49 years telling him to say, look, you either go shower or I'm out of here? Come on.
I don't understand this. Yeah, just so there's not enough there, right? Like, we don't know his reaction. Did he say, no, I don't stink? Because that is a markedly different problem.
Yes. If he's acting like he don't smell, then obviously he's a fool.
Yeah.
And maybe he does have dementia. But if he just does flat out not care, he's 71 years old, Ron's done giving any type of crap to anybody. He just says, nope, I'm going to stink, and I'm going to do what I want, and I'm done. Good luck, man. You know what I'm saying? I'd send the kids in to talk to him. I think his son should be able to straighten that out.
Yeah, I agree. All right, you've been listening live from the path. Thanks for hanging out with us tonight. Big thanks to Matthew Loftus for getting up early in East Africa to talk with us about healthcare stuff. We probably got a break next week, and then we got some more. The other thing that we wanted to talk about when it comes to good news changing the world had to do with sex trafficking, and I think we're going to be able to hit that on the first show in December. First show in November, excuse me. Yeah. And so that'll be exciting, and we'll keep making progress on how good news changes the world. Hey, maybe this is something that you want to get involved in. Maybe I'll post a link to his article, and you can check it out.
Probably along with the name of that book that he recommended by Daniel Hale.
Yeah. I think it's in the article, so
Okay.
we can check that out. But there's churches that do free clinics and stuff. Maybe that's just something we can expand on and see what we got going on. I feel like neighborhoods could benefit from people who have half a brain on something. Have been taught a little bits of things, and I don't know, maybe it helps the process, maybe it doesn't, but you can only control. Helping people's always good, so it seems like a good place to start. Anyway, in the meantime, be faithful in the means. God will handle the ends. You've been listening to Live from the Path.